All right, welcome to the deep dive. Today we're jumping into nursing fundamentals.
We're going to dig into those core ideas and skills that'll help make you a great nurse.
Yeah, we're giving you like the ultimate guide to your nursing textbook.
Exactly. We'll break it all down, hit those key points, and make sure it all clicks.
You know, something that really stood out to me in all this material is this idea of the eye patient. You know, like almost how technology can be a barrier between us and really connecting with our patients.
It's interesting, right? We have all this incredible technology in healthcare, but we got to remember it's just a tool, you know? It shouldn't overshadow that human connection, which is really at the heart of nursing.
Yeah, it reminds me of that story about the nursing student, right? The one who had the patient, and all the staff thought she was demanding, but this student actually took the time to listen to her.
Right.
And turns out there was a lot more going on than just her complaints at the surface.
That's a perfect example of what it means to practice person-centered care. So instead of just focusing on tasks and tech, this student, she saw the person behind the illness. And that's what we have to do as nurses, treat each patient as an individual with their own, unique needs and experiences.
So we're talking about treating the whole person, not just the illness. But how do we actually do that in practice? It feels like there's so much to learn and so many different approaches.
That's where nursing theories come into play. Think of them like frameworks to understand nursing and guide our practice, like different lenses, you know?
Okay, like what?
Okay, so there's Benner. She's a prominent theorist. She talks about the importance of the nurse's helping role, you know, like the way nurses guide and support patients through their healthcare journey.
So not just doing things for them, but doing things with them.
Exactly. And then there's another theorist, Swanson, and she focuses on the caring process. It's a 5-step framework. It's all about knowing the patient, being with them, doing for them, enabling them, and maintaining belief.
There's this quote from the material that really stuck with me. It said, and I quote, "Caring was unthinkable to consider sick humans as mere bodies."
Wow.
It's like a reminder that caring goes way beyond just addressing those physical symptoms. You know, it's about the emotional, social, even the spiritual parts of a person's experience.
Totally. And that brings us to another piece of nursing, developing those core competencies. That's what's going to make you a well-rounded, effective nurse. We're talking about cognitive skills, technical skills, interpersonal skills, and of course, the ethical and legal stuff.
When I was just starting out, honestly, the number of skills we had to learn, it felt kind of overwhelming. Like, where do you even start?
It can be. It helps if you think of them as tools in your nursing toolkit. You need good cognitive skills for critical thinking, problem solving. That's what helps you analyze situations, make judgments, and choose the right path, you know?
So cognitive skills are all about being mentally sharp, able to deal with like all the curveballs nursing throws at you.
You got it. Then you've got technical skills. Those are the hands-on skills, the ones you need for direct patient care.
Like giving meds safely, knowing how to use the equipment, performing those procedures precisely.
Exactly. But it's not all technical. Nursing is about relationships, too. That's where interpersonal skills come in. Being able to communicate well with patients, their families, the whole healthcare team.
Yeah, I think that's what made me want to be a nurse, that human connection. But it's not always easy, is it? Especially with all the other demands and responsibilities we have.
It's a constant balancing act, for sure. And then you have those ethical and legal competencies. These are the things that guide how we practice. You have to know your scope of practice, standards of care, and the legal rules to protect both you and your patients.
It can feel a little daunting, that ethical and legal stuff, but it is so important for practicing responsibly and advocating for our patients, right?
And actually, the material even suggests that one of the best legal safeguards we have is building that strong sense of ethical accountability and, keeping up with competent practice.
So like the more we know and the more skilled we are, the
Yeah.
better advocates we can be for our patients and for ourselves.
Exactly. Now let's shift gears a little and talk about something that's at the core of everything we do in nursing clinical reasoning. It's how we bridge the gap between what we know and what we actually do.
When I was a student, I remember clinical reasoning felt like this big mystery, like some code I had to crack. How do you explain something that seems so, instinctive?
Well, one way to think about it is as that internal GPS, the one that helps you navigate all those complicated patient situations you'll see.
So taking all that textbook knowledge and applying it to the real world.
Exactly. And the material actually gives a really helpful model for understanding clinical reasoning. Breaks it down into 8 steps.
Okay.
Considering the patient situation, collecting those cues and information, processing it, identifying problems, setting goals, taking action, evaluating outcomes, and reflecting on it all. You're always cycling through those phases.
It's like this constant loop of assessing, planning, implementing, and evaluating, all while using your critical thinking skills.
And speaking of critical thinking, that's another big one. It's about being curious, asking questions, challenging what you think you know, and always trying to understand the why behind what you do.
I love that. Always asking why. Keeps you engaged and keeps you from just going through the motions.
The material actually has a list of critical thinking indicators. It's a great way to check in with yourself. Are you open-minded, inquisitive, analytical, reflective? All those qualities will make you a better nurse.
That's a great checklist. Now let's dive into something I know is a huge part of nursing, the nursing process. It's like the roadmap for every patient interaction.
It is. The nursing process is that system that makes sure our care is individualized, holistic, and based on evidence. And it's evolved a lot over the years to be truly patient-centered.
Walk me through it. What are those key steps?
It all starts with assessing. That's gathering info about your patient, their medical history, current symptoms, lifestyle, who they have for support, everything. You're trying to get the full picture.
So assessment is like detective work, right? You're gathering clues to understand what's going on.
Exactly. Then you move on to diagnosing. This means analyzing all that data, figuring out the patient's health problems, and how they're reacting to those problems. We're talking about nursing diagnoses here, which are a little different than medical diagnoses.
Right. Nursing diagnoses look at the patient's response to a health condition.
Yeah.
So, a patient might have a medical diagnosis of pneumonia, but the nursing diagnosis could be ineffective airway clearance because of all the mucus in their lungs.
Perfect example. That nursing diagnosis lets you zero in on the specific areas where you, as a nurse, can actually make a difference, improve the patient's well-being.
Okay, so we've assessed, we've diagnosed. What's next?
Planning. Now you've got a good grasp of the patient situation. Now you develop a care plan. It outlines the goals you and the patient want to achieve and the actions you'll take as a nurse to get there.
Planning is where you really get to work with the patient,
Yeah.
right? Not just for them.
Exactly. It's all about creating a plan that's just for them, tailored to their needs and what they want. The plan should have those measurable goals, specific nursing interventions, and a timeline for checking progress, making sure everyone's on the same page, working towards the same results.
Then comes the action, putting that plan into motion.
Exactly. Implementing those nursing interventions. That could be anything from giving meds and treatments to patient education, emotional support, coordinating care with the rest of the healthcare team. You're always monitoring and adjusting as needed.
Implementing is where you get to see all your hard work pay off, right? Hopefully seeing the patient start to make progress towards those goals.
Yes. And finally, you have evaluating. This is where you step back and ask, is this plan working? Is the patient moving towards their goals? Do we need to tweak anything?
Evaluation is so important because it makes sure we're always checking our care, and making sure we're doing what's best for the patient.
It's that constant loop of assessing, diagnosing, planning, implementing, and evaluating. That's what makes the nursing process so powerful.
Wow, we've covered so much already. Thoughtful practice, person-centered care, all those tools you need in nursing, clinical reasoning, and that super important nursing process. It's a lot to take in, but it all comes back to that core idea, providing compassionate, individualized care to every single patient.
And remember, these are just the basics. There's a whole lot more to explore as you go deeper into nursing. But with these principles as your guide, you're on the right track to becoming an exceptional nurse.
We'll be back with part 2, where we'll unpack even more of those essential skills and knowledge you need. But for now, take a minute to think about what's really resonated with you. What stands out as the most important takeaway? And how do you see yourself actually using these ideas as you move forward on your nursing journey? Welcome back to our deep dive into nursing fundamentals.
We're picking up right where we left off, exploring all those important concepts and skills that, make up the foundation of nursing practice.
Last time we talked about person-centered care, all the skills you need, that clinical reasoning, and of course the nursing process.
And now we're going to get into some specifics about nursing knowledge, things you need to master. Let's start with standardized nursing languages.
Okay, full disclosure, when I first heard that term, I don't know, it was a little intimidating. It sounded so technical. Can you break it down for me?
Sure. Think of standardized nursing languages as as a way to make sure everyone in healthcare is speaking the same language when it comes to patients.
So it's like a universal language for nurses.
You got it. Imagine traveling to a country where you don't speak the language. It'd be pretty hard to communicate, right?
Yeah, I can imagine a lot could get lost in translation.
Exactly. That's why we have these standardized languages. They give us the same words, the same framework for, documenting and talking about patient information.
So instead of everyone using their own terms and interpretations, we have a standardized way to describe, like patient problems, interventions, outcomes, all that.
Yep. And there are a few organizations that have developed these languages. One you'll hear a lot about is NANDA International. They focus on nursing diagnoses.
Okay, so instead of just saying a patient has pain, we would use a more specific NANDA diagnosis, like acute pain or chronic pain, right?
Yeah.
Depends on what's going on.
Exactly. And there's others too, like NOC. They give us standardized language for nursing interventions. And NOC, that focuses on patient outcomes.
So NIC is for the actions we take, and NOC helps us measure if those actions are actually working. It's like having a shared playbook for nursing care.
Great analogy. These languages, they're so valuable. They improve how we communicate, make sure care is consistent, and ultimately keep patients safer.
It's all about making sure we're all on the same page so we can give our patients the best care possible.
Now, let's switch gears a bit. Let's talk about older adults, a population that often has unique needs.
Taking care of older adults definitely comes with its own set of challenges and rewards.
Definitely. They often have really complex needs, multiple chronic conditions, and they might be dealing with those age-related changes that affect, their physical and cognitive abilities.
So it's even more important to really focus on their individual needs and what they want.
Absolutely. The material really highlights promoting dignity and respect for older adults. That means communicating in a way that supports their well-being, being aware of any physical or cognitive limitations they have, and involving them in decisions whenever possible.
It's about recognizing that each older adult is an individual, right, with their own life story and experiences.
And understanding the common challenges they face, like being isolated, losing their independence, needing help with everyday things.
There's this interesting exercise in the material. It asks nurses to think about how their communication style, even nonverbal cues, can affect older adults.
Yeah.
Made me realize even something simple, like touching their shoulder, it can be comforting, but it also could feel intrusive to someone.
That's a great point. We have to be super aware of our nonverbal communication, especially with vulnerable populations like older adults.
The material also talks about establishing those caring relationships with patients. It seems like a simple idea, but it can be hard to really connect when you have so much going on as a nurse.
It is. It's a balancing act. We're always under pressure to be efficient, see lots of patients, document everything, and sometimes it feels like there's just not enough time to connect on a human level.
I remember a story in the materials about a doctor who became a chaplain.
Hmm.
He realized the most valuable thing he brought to his patients was just himself, his presence.
Wow. That's a powerful thought. It speaks volumes about how important that human connection is for healing.
It made me wonder how we can prepare ourselves, mentally and emotionally, to be really present with our patients, even on those crazy busy days.
Something as basic as taking a deep breath before you go into a patient's room can make a world of difference. Just helps you center yourself, approach the encounter with intention.
It's like a little reminder, right? This is a person, not just another item on your to-do list.
Exactly. And those moments of connection, even if they're quick, can be so rewarding for both of you. Reminds us why we do what we do.
So now let's talk about a skill that is absolutely essential for nurses: critical thinking.
Critical thinking. That's like the engine driving all our clinical decisions. It helps us analyze, solve problems, provide safe and effective care.
But it's more than just thinking logically, right? What makes someone a good critical thinker?
The material mentions a bunch of important qualities, like being open-minded, inquisitive, analytical, and reflective. It's asking those why and what if questions, challenging what you think you know, considering different points of view.
Like being a detective, always looking for clues and piecing together the puzzle of what's going on with your patient.
And it's about knowing yourself, your own biases, being willing to change your mind when new information comes up. Remember, in nursing, we never stop learning and growing.
There's a helpful list in the material. It's called Personal Critical Thinking Indicators, like a self-check, It asks things like, am I really curious? Do I communicate well? Am I willing to look at my own practice and make changes?
Those are all fantastic questions to ask yourself as you work on your critical thinking. And remember, it's like a muscle. It gets stronger. The more you use it, the more you think critically, the more natural it becomes.
Okay, so we've talked about standardized nursing languages,
Mm-hmm.
caring for older adults, building those important caring relationships, and really getting good at critical thinking. What's next on our deep dive? Welcome back to the final part of our deep dive into the fundamentals of nursing.
We've covered a lot of ground, haven't we? From person-centered care and the nursing process, all the way to critical thinking and those standardized nursing languages.
Yeah.
Super important stuff.
And now we're going to tackle a topic that every nurse needs to know: ethical and legal considerations.
Right. These are the principles that really guide all our decisions. Make sure we're practicing the right way and protect our patients, their rights and well-being.
Ethical dilemmas, those can be some of the toughest things we face as nurses.
Yeah.
How do we handle those situations where, there's no easy answer, no clear right or wrong?
Well, the material really stresses building a strong sense of ethical accountability. It's about knowing that professional code of ethics, understanding where your practice legally begins and ends, and always putting your patients first.
It also mentions that one of the best ways to protect ourselves legally is by, keeping up our skills and being competent.
Exactly. The more we know, the more skilled we are, the less likely we are to make mistakes that could harm our patients. Staying current on the latest research, best practices, and continuing education, all that is so important for giving safe and effective care.
There are some questions in the material that every nurse should ask themselves pretty regularly, like, do I actually know the legal limits of what I can do? And am I up to date on my institution's policies and procedures? That kind of thing.
Those are excellent questions to think about. It's on us to know our scope of practice, those standards of care, and all the legal guidelines that, govern our profession.
And those guidelines, they can change.
Yep.
So we have to keep learning, always stay informed, and, adjust how we practice as needed.
Absolutely. Nursing is always changing. We got to change with it.
Huh.
The material also talks about finding that balance between caring for patients and caring for ourselves.
That's a good one.
It warns against, not doing enough, but also doing too much or too little responsible caring. It can be a problem.
That's something I think a lot of nurses struggle with.
Yeah.
We're naturally caring people. We want to do everything we can, but we also have to know our limits.
Right. Like they say, you can't pour from an empty cup. If we're burned out, exhausted, overwhelmed, we can't give our patients the care they deserve.
And on the other hand, we can't take on so much of our patients' burdens that it hurts us. We have to have those professional boundaries.
Finding that balance is key. Giving great care, but not at the expense of our own, physical, emotional, and mental health.
So let's talk about something designed to promote really great nursing care. The QSA competencies.
Oh, yes, QSA. That stands for Quality and Safety Education for Nurses. It's basically a project to make sure nurses have the knowledge, skills, and attitude to keep making healthcare safer and better.
So making sure nurses are ready for all the challenges of healthcare today and can give the best possible care.
Exactly. Those QSA competencies include, patient-centered care, teamwork, using evidence in practice, quality improvement, safety, informatics. They're woven into everything we do in nursing, education, and practice.
It seems like these competencies fit perfectly with all those basic principles we've been talking about.
They really do. They're a natural part of what nursing is all about. Compassion, respect, professionalism, and that commitment to always learning and growing.
Speaking of always learning, the material really highlights reflective practice. Can you expand on that a bit?
Sure. Reflective practice is taking time to really look at your experiences, see where you can grow, and make changes to be even better. Like hitting pause, think about what went well, what could have been better, and what you learned from each patient.
So it's not just focusing on our weaknesses, it's also about recognizing what we do well and celebrating those wins.
Of course. Being honest with yourself about the good and the bad, the areas where you can improve. The material suggests some questions like, what happened? How did it make me feel? What were the good parts, the bad parts? What can I take away from this whole thing?
Those questions, they can really help us process our experiences, Make sense of those complicated situations we deal with all the time as nurses.
And reflective practice, it's not a one-time thing. It's something we do throughout our careers, helps us keep growing and evolving as nurses.
So as we wrap up this deep dive into nursing fundamentals, I want to leave our listeners with one final thought.
Okay, go for it.
Nursing, it's more than just a job, It's a calling. It takes knowledge, skill, but also compassion, empathy, and a genuine desire to make a difference in people's lives. You're starting an amazing journey, and everything you've learned in your fundamentals course, those are the building blocks for everything that comes next.
Couldn't have said it better myself. Embrace the challenges, enjoy the rewards, and never stop learning. You've got this.
Thanks for joining us for this deep dive into the world of nursing fundamentals.